Hi, so we're here with Dorothy Yeung, who just gave us a few words at the Healthcare General Session, and thought we'd find out maybe a little bit of what she talked about and hear her thoughts on how the session
I'd like
went.
to start out by saying that the pro-life movement has always been equally committed to protecting the vulnerable, the people with disabilities, and the elderly from euthanasia and assisted suicide, denial of health care. We've always been just as concerned about that issue as we have about protecting unborn children from abortion. And this morning we presented our pro-life proposal to the healthcare crisis in the United States, which would not result in healthcare rationing to those who are vulnerable, those who have disabilities. And we also called upon everybody here at the National Right to Life Committee, and those of you who are listening to my voice now online, to please contact your senators who are sitting on the Health, Education, Labor and Pensions Committee in the U.S. Senate. A critical vote will be coming up on Monday, and we have offered pro-life language that Senator Enzi is offering. And we are asking you this weekend to contact your senators and those that sit on the Health Committee and ask them to support the Enzi amendments that would essentially prohibit the government from using quality of life criteria to deny life-saving medical treatment to people with disabilities or people who are elderly. We do not want them taking quality of life into consideration, and those amendments would be very protective.
Cool.
And we're also here today with the Will to Live project.
Yeah, I was going to ask you about that.
We have one healthcare power of attorney, pro-life, for each of the 50 states, and various people have been coming in throughout the morning and expressing their wishes, their pro-life wishes for life-saving medical treatment and food and water. It's sad that we have to do that, but we do have to do that, and these are legally binding documents for each of the 50 states, and we are happy to provide that for our attendees today.
Wow, that's really great. Well, thanks, Dorothy. Do you have anything else to add before we sign off?
Not at all, but we look forward to seeing you next year if you didn't make it this year.
Great. Thanks a lot.